Hey, look, Zeke, you um, have had one of the more interesting healthcare careers in the country. I think you're an oncologist, you're a bioethicist, you're an author, you've been a policymaker, you're now vice provost at an Ivy League university. You have been an investor. You are an investor. You were featured in a Times article with a pretty provocative headline. I think it was that restarting America means people will die. So when do we do it? And I think it's not necessarily a question of when, but it's a question of when and how, right? And I know, Zeke, you're talking to a lot of governors out there, and a lot of what you just opined on was kind of judgment-based stuff and a little bit on kind of federal leadership and things like that. But as you talk to governors, I think a lot of this question centers around the how, right? What levers does a state government have to do some of these things? And how can states who, are facing their own capacity constraints, by the way, none of them have ever had to do anything like this before, how can they be as successful as possible? And what advice are you giving governors out there?
Well, I think the main thing so one thing is not to rush. I think that is a recipe for a mistake and a recrudescence of high numbers of cases. The second thing is they really do need to do everything they can, and I understand that they're often constrained to get the testing capacity and the contact tracing in place. Not everyone can call upon, Mike Bloomberg to pay for contact tracing, but you do need to get those things in place. You need to do extra special protections for seniors and people with serious comorbidities in nursing homes, but not only in nursing homes. So I think that's the infrastructure. If I said, take the next 6 or 10 weeks and try to get that in place. And believe me, I'm involved in Connecticut and listening to their officials about the frustrations in getting testing in place. And this is a state with 2 medical schools, some major labs, some major companies with testing capacity, and yet they're struggling with it. Gives you a real, and it's not for lack of effort or lack of coordination. It's just a hard problem given the supply chains, etc. Going forward. So I think, but you got to try to get that in place. I think as we open this, one of the points I do make to governors is, let's remember life is not risk-free. So we can't get COVID risk to zero. We need to get COVID risk low. And partially it's a psychological question. How low is going to make people feel comfortable that they can begin engaging in some of the physical and economic activities we want them to engage in, but also not go too far. So I think getting that balance is important. I think the other thing that is really important that I do emphasize is this issue of normalizing wearing masks in public. We had a long time of not getting it right. Early in April, on April 6th, my first co-hosted TV show, I came out and said, got to wear masks. Before the CDC had changed its guidelines. And I think we were mistaken. Legitimate reasons to be cautious. We didn't want to take masks away from healthcare workers, and we thought if people wore masks, they might feel they're invincible. That was a mistake, and clearly a mistake, and we should make it more normalized so that it's abnormal if you're not wearing a mask out in public, and that it's like wearing a seatbelt. We got to make it that simple.
When you think about your advice to governors, when you think about compliance type issues, right, that we're over a year out from a vaccine. Life between now and then will be different, right? Even if we do begin to try to normalize as much as possible, it will be different. There's a real trade-off, by the way, between how different it will be and how ready and competent governments and other organizations are in helping us live life in a way that we can guard ourselves from contagion, right? And so when you think about all these things, how do you wrap your head around the compliance question and what states in particular can do, what other organizations can do to get a country of more than 300 million people ready for a long-term, relatively long kind of change in behavior here?
Well, you have to. So I think there are two things. One is you got to recognize that, or three things. One is you got to recognize that's not going to be by law, right? The law is not going to get the country ready, so it's not illegal. Therefore, it has to be social norming has to be in place first. Second, you're going to probably need multiple drugs. So getting two drugs that are effective, that's even harder. Okay, I actually think it's more likely we're going to get an effective vaccine than we are an effective therapeutic. I could be wrong on that. We might hit it lucky, but I'm a little more skeptical about that. The last thing I would say is we need the kind of support for the public, money, that recognizes it's going to be 18 months. Now, it doesn't mean no economic activity. It means lower economic activity. So we've got to work on what are the right supports. And we have an unemployment system that covers 40% of workers, not everyone. We need an unemployment system that covers everyone, whether you're a gig worker or not. Is this going to put, I'm as big a deficit hawk as there is. I care about my grandchildren, my great-grandchildren. And that inherently makes you a deficit hawk. But we have to print money. Given that inflation is zero, it's probably going to be negative. We're going to have deflation. We're going to have to print money to help people, and it's not going to be a problem. I mean, what did Keynes say? Have them dig, ditches and fill them in, and we'll pay them for that. We're just going to have to do it. And I think this short-termism is counterproductive. It doesn't persuade people that the timeline. Do I think we're going to come back? Yes. We experienced the Black Death. We experienced 1918, and we came back, and we came roaring back. It did change things. I think this will change things permanently, but I just don't see that this, basically doing something for 3 weeks or 3 months is the right psychology.
Well, look, while we're all dealing with this large exogenous event, and there are some things that are out of our control, there is a lot that is in our control too. So let's hope that we have the potential to end up on the better side of things versus the worst side of things.
Well, look, I think one of the things that we're going to face a new administration, just let me conclude with that, is if we get a vaccine, how are we going to scale up and make sure we have the infrastructure to deliver it? And critical, you got to start now. And, I think it's really good that someone like Bill Gates is thinking about that and beginning to mobilize the resources he can mobilize for that. But there really is a federal government, state government, you got to coordinate. It's got to be very, very, but you got to start now thinking about it, not waiting to, we got a vaccine, now what? And run around.
Well, Zeke, hey, look, thank you again. I really appreciate it. Thanks for taking the time on a Sunday afternoon, no less. Always interesting to chat, and I'm sure we'll talk again soon.
Take care. Thank you.